When someone is having a stroke, time is brain. Time saved equals brain saved. Heading to a comprehensive stroke center is important, but if you can't be there right away, those experts are connecting with patients and other doctors virtually. Find out how.
It was like somebody was holding me down on the back of my neck. You know, I was, well, immobilized, actually.
Immobilized and frightened, a Lancaster County man and his wife share about his stroke and recovery. In addition to treating a patient after a stroke, we're going to hear about new treatments, elective ones, that could possibly prevent strokes from happening. And happening right now, experts are here in our studio taking your questions during a live web chat. To ask your questions, visit abc27.com/chat. Good afternoon. Thanks for being with us. It's a special Good Day PA brought to you by Penn State Health. I'm Amy Kem. Strokes are medical emergencies, and as you will learn today, there are key points to improve the outcome: prevention, awareness, and early action. Where you receive treatment matters. Penn State Health Stroke Center is classified as a comprehensive stroke center, and that is significant. Why? Take a look.
Did you know another term for stroke is brain attack? For every minute a stroke is left untreated, the average patient loses nearly 2 million neurons. In 1 hour, the neuron loss equals around 3.5 years of normal aging. Literally speaking, time is brain. In the United States, 2 types of certification for stroke centers are primary and comprehensive. Although there are many primary stroke centers, there are far fewer comprehensive stroke centers that meet the distinguished criteria. And Pennsylvania is no different, so why should you care? A primary stroke center can care for most stroke patients. A comprehensive stroke center cares for complex stroke patients. A comprehensive stroke center also has 24/7 neurosurgical availability, along with a dedicated neuroscience intensive care unit for stroke patients, while a primary stroke center must have neurosurgery access within 2 hours. If the stroke is too complex, the patient will likely be sent to a comprehensive stroke center for treatment. Remember, time is brain. And here's the cool part. Right here in Central PA, Penn State Stroke Center is proud to be designated the only comprehensive stroke center in the region. We're honored to serve the community, and thank you for entrusting us with your care.
Well, again, today we are talking about stroke prevention, awareness, and early action. Carrie Perry is here with a Lancaster County man story.
Yes, that's right, Amy. Bob Bueller of Ephrata is a very healthy, active man. And then one day in early January, he was hit with the unexpected. Here's Bob's story.
I like to be going down the road and maybe see a small hill or a long incline and drop down another gear and ask my legs to get up there, you know. It makes me feel like I'm alive.
Bob Bueller is lucky to be alive. At 77 years of age, he had a stroke only 3 days after suffering a heart attack. His wife, Peg, recalls the morning well.
He said he fell and he couldn't get up.
It was like somebody was holding me down on the back of my neck. You know, I was, well, immobilized, actually.
I just assumed he was weak from the heart attack.
Then I started falling down, you know.
Peg knew this was serious and called 911. Bob was rushed to a local ER where they used telestroke to connect with a stroke specialist at Hershey Medical Center.
The doctor in Hershey did an exam while he was in Ephrata.
On the day of Bob's stroke, Dr. Reichwein was the on-call telestroke consultant doing Bob's exam.
On my laptop, I signed in and was there within 10 minutes and came right to his bedside. They have a card on their side, and it's two-way audio video. So he was awake, mildly confused, and to a neurologist, he had what's called neurological neglect. He wasn't paying much attention to his left side, and on his CAT scan, he had a bright area in 2 of the major brain arteries. That white spot is consistent with an acute blood clot in those blood vessels.
Bob was given the clot-busting drug TPA by IV in an attempt to dissolve the clot that was causing his stroke.
And it has to be given within 3 to 4.5 hours from the onset of symptoms. In the world of acute stroke care, the first hour is a critical moment. So from the symptom onset to being on the ED doorstep within an hour is critical, and he was there roughly at 1 hour from the onset of the symptoms.
There are a few things important to note about Bob's story. To Peg, his wife, Bob did not show what she thought of as the typical signs of a stroke: no slurred speech or facial paralysis. But what Peg did do right is that she immediately called 911, which is what doctors recommend if a person shows any signs of possible stroke distress. Later in the show, we'll have the conclusion to Bob Bueller's story. Now to Amy.
Okay, thank you so much, Carrie. Well, joining me now is Dr. Jay Reichwein, co-director of the Penn State Stroke Center. Let's go back to basics. We heard you talking that story. What exactly is a stroke?
So stroke is sudden onset brain injury that's caused by a blood vessel problem. The most common is called an ischemic stroke, where a clot or debris blocks up the blood vessel and the tissue beyond that dies. The other common one is a hemorrhagic stroke, which is where a blood vessel bursts and brain is distilled in and around the brain itself.
So, what are some of the risk factors? Would someone know they're at risk for this?
So the most important thing is 80 to 90% of all strokes are preventable via several common risk factors out there. The most common are high blood pressure, diabetes or high blood sugars, and high cholesterol. Other common causes include blockages in the neck arteries called carotid artery disease, or the brain arteries, and with advancing age, an irregular heart rhythm called atrial fibrillation. Lastly, in younger patients, migraine with aura, birth control pills, and some anti-inflammatory medications can be associated with stroke.
And there are things that maybe you can't control, right?
Right. So age, genetics, as far as race. So there clearly are things not to control, but many of the modifiable ones can dramatically reduce risk.
And I mean, this is very important. We say that time is so important during a stroke. What should people look for?
Right. So the acronym that's out there now is called BFAST, and B stands for balance problems, E stands for an eyesight problem, either double vision or loss of vision. The F stands for face, facial weakness or droop or numbness. The A stands for arm, weakness or numbness. S is a speech problem, either slurred speech or problems articulating your thoughts. And then the T emphasizes time and calling 911 and the EMS system to provide prompt care.
Very good. And of course, we want to do that right away. Thank you so much, Dr. Reichwein. Well, as part of today's special Good Day PA, we have a web chat going on right now with experts from Penn State Health. Let's turn it over to Deborah Pinkerton.
Thanks, Amy. Joining me right now is nurse Alicia Richardson. She is the Penn State Stroke Program Coordinator. Here is the first question. Is it true there are more younger people having strokes now?
Yes, we've actually seen an increase in the age group 25 to 44. Over the last 10 years, there's been an increase to about 44%. And typically this is much lower than that, so it is on the rise.
And any reason why?
We're finding that a lot of people are having more older person diseases like high cholesterol, high blood pressure, and diabetes in that age group.
Okay, here's another question. Now, this is something that Dr. Reichwein just briefly touched on. I've heard of time is brain. What does that really mean?
So what that means is a lot of our treatments for stroke are time-based, and the time window is pretty short, within hours. So if you miss that opportunity, you lose a brain tissue, basically.
Okay, Alicia, we will be talking to you just a little bit later in the show. And if you would like to submit your question to the experts at Penn State Health, log on right now to abc27.com/chat. Back to you, Amy.
Thank you so much, Deborah. We're going to check back with you in just a bit. Also in a bit, the conclusion of Bob Bueller's stroke recovery journey. Carrie will explain what action experts took to make him well. We'll also hear about treatments offered at Penn State Stroke Center, some of which could prevent stroke. That's next on this special Good Day PA on ABC 27. Well, continuing our story, Bob Bueller had just experienced a stroke. He and his wife took fast action. Carrie Perry is here with more of Bob's story.
Yeah, thank you, Amy. Through the technology of telestroke, Dr. Reichwein was able to assess his condition while Bob was in another hospital. There it was determined that Bob needed more aggressive intervention, and he was flown to Penn State Hershey Medical Center by Lifeline. As the only comprehensive stroke center in the region, Penn State Hershey is capable of providing more advanced intervention for patients like Bob.
So when he arrived here, since he had not really improved with the other drug, the clot-busting drug, now we're looking at other options. And so to decide whether he's eligible to get another option, which would be a catheter to go into the brain and pull out the clot, then we need to assess whether he still has some tissue that is salvageable or savable in the brain. We did a CAT scan angiogram and a CAT scan perfusion study. This is the blood flow study, and this is the blood volume study. So the blood flow is decreased here, and you see these colder or darker colors. That means there's low blood flow. But then when you look at the blood volume map, which is this set of pictures over here, you'll see that it actually looks pretty much the same on both sides. So that tells us that the blood volume is in fact preserved, and so therefore that this tissue, this area here, which is the same as this area here, is actually salvageable. We can save this tissue if we can restore the blood flow.
With salvageable tissue, Dr. Cockcroft performed the angiogram study.
He was awake. He was not really experiencing any discomfort at that time, other than being concerned that he could not move his left side. But what we found when we first put the catheter in, and this is the catheter tip just here, we injected the contrast dye, and the contrast dye just stopped.
The point where the dye stops indicates the location of the clot, which must be removed before Dr. Cockcroft can remove the other clot seen on the scan. By inserting a catheter into the carotid artery, Dr. Cockcroft was able to remove the first clot.
This then is the picture after we have gone through with the catheter and aspirated or suctioned out the clot. After opening the blood vessel in the neck, we then move on to opening the blood vessel in the brain. So then we take a small catheter and go through the blockage, and it's through this catheter that we're going to deploy a device to pull out the remaining clot, which is now sitting in this blood vessel right here.
This animation illustrates the procedure used by Dr. Cockcroft to suction out the clot which caused Bob's stroke.
Here's that carotid artery, which used to end right about here. Now you can see it's open.
The blood flow was able to be restored to the right side of Bob's brain, and he was soon able to begin his journey to recovery. Bob and Peg are grateful for the telestroke technology that made it possible for quick expert assessment while still in their local hospital, and for the doctors and medical support staff at Hershey Medical Center.
There was constant communication. I mean, they'd bend over backwards to keep us informed of whatever needed to be done.
They were excellent. Yeah, I don't think I could have went to a place that was better than what I received there as far as care goes.
6 months after the stroke, and at age 77, Bob celebrated his recovery with a 5K.
Well, I felt strong. Running and walking, that I could handle.
His wife Peg sees the joy in Bob with his ability to get back to the fitness he so enjoys.
Exhilarated, you know, glad to be alive.
Bob continues to do well and follows up with his doctor regularly. Telestroke technology makes it possible for quick expert assessment of a patient while still in their local hospital. Especially in Bob Bueller's case, it can lead to a much more successful outcome. Now to Amy.
Okay, thanks so much, Carrie. Now for more on Bob Bueller's treatment, we are joined by Dr. Kevin Cockcroft, who you saw in that video there. He's co-director of the Penn State Stroke Center. Let's talk about Bob's treatment, the procedure that he had. What is that procedure?
Yeah, so the procedure Bob had was called a mechanical thrombectomy. That's where we take a catheter and we go up into the brain, and we use a device to either grab a hold of the clot or to suction out the clot and then remove the clot that's blocking this blood vessel going to the side of his brain.
Now, of course, that's just one surgical intervention. There must be more to treatments.
Yes, there's lots of other treatments. So sometimes if we're not successful, or if the clot-busting drug is not successful, people can have some major swelling of the brain, and we need to do a surgery where we take off part of the bone from the side of the skull to allow that swelling to not cause more damage. And then sometimes we can even go in for hemorrhagic or bleeding strokes and take a procedure to actually physically take out clot that's in the brain substance itself.
Is Hershey Medical Center working on anything new? Do you offer anything new in stroke treatment right now?
Well, there are lots of new things that come up all the time. One of the new things that we're excited about right now is a special device for removing these hemorrhagic strokes or blood clots within the brain, where we can take a very small catheter-like device which basically chews up and breaks up the clot and then suctions it out. And we can do this through a very small port as opposed to having to make a major opening in the side of the head.
Now, earlier we were talking with Dr. Reichwein about all the risk factors. Do you actually have treatments that can help prevent a stroke from happening in the first place?
Yeah, so sometimes these other medical management things that we do are not enough, and so we need to do other procedures. One of the most common procedures we do is called a carotid endarterectomy. And this is where we go into the neck itself and we open up one of the major arteries that goes to the brain. We clean out the plaque or the atherosclerosis that's in there that can contribute to a stroke. We can also do that procedure with a catheter using a stent and a balloon. And then for the hemorrhagic strokes, those are the bleeding strokes, we can treat brain aneurysms, we can treat brain blood vessel malformations either through catheter techniques, open surgery, or even forms of radiation called gamma knife radiosurgery.
It's also interesting, and again, Penn State Stroke Center is a comprehensive stroke center, so of course this is really the best place in the area, absolutely, to go. Good to talk with you. Thanks for sharing all that information with us. Now, as you've heard over and over today, time is crucial in getting a stroke patient treated. Just ahead, the role that Penn State Hershey Medical Center's chopper plays in saving that critical time. And this reminder, our web chat continues until 1:30 this afternoon. Log on to abc27.com/chat. We'll be right back with more of this special Good Day PA. As you've seen, quick action is crucial to stroke patient care. Lifeline can be a pivotal part of that. Last year, Lifeline transferred patients from more than 80 different facilities throughout the tri-state area to Milton S. Hershey Medical Center. Now, when a doctor calls the Penn State Health Transfer Center to transfer a patient to Hershey Med, they are connected with a registered nurse and then a physician. During a telestroke consult, a page is sent out to all Lifeline on-duty personnel, notifying them of an active consult. After determination of care need and coordination in terms of pilots and weather for flying, patients can be transported by air. Now, this helps experts get to the patient's bedside faster. Lifeline has worked very closely with the Neuroscience Institute at Penn State Health to establish medical treatment protocols for stroke patients. Experts from Penn State Health continue to field questions from you about stroke care. We're going to hear more questions and get more answers straight ahead. As today's ABC 27 Penn State Health web chat continues, we check in now with Deborah Pinkerton.
Amy, we're talking with nurse Alicia Richardson. We have time for a couple more questions. Is there anything new in stroke recovery?
Yes, so actually this fall we're going to be starting IV stem cells and also transcranial magnetic stimulation, which is basically magnets on the brain to help create new brain connections. Both of these treatments help with motor recovery and speech and language.
Okay, so they help the recovery process.
Correct.
Okay, if we recognize someone is having a stroke and we call 911, is there anything we can do to help while we wait for the ambulance?
Sure, so just make sure the person's comfortable, but also knowing when exactly this happened, like what time it is really important for us to know to see if they're eligible for those treatments. And also a good medication list is really important, and a contact number, so who we should call once they've arrived at the hospital.
Okay, thanks so much.